Good morning and welcome to the Columbus Chamber of Commerce's Government Spotlight Series. My name is Stephanie Megas. I am the Government Affairs Manager for Charter Communications here in Central Ohio. You know Charter better as Spectrum, our brand of connectivity services. Spectrum is the presenting sponsor for today's program. And on behalf of our 2,000 Central Ohio-based employees, we're very excited to support this dialogue on COVID-19 testing. Over the past several months, Spectrum has stepped up to meet the community's connectivity needs. As a company, we want to do what we can to help ease the strain during a very difficult time. For households with K-12, college students, or educators who do not already have a Spectrum broadband subscription, we are offering free Spectrum broadband and free Wi-Fi for 60 days. We've opened our Wi-Fi hotspots across our 41-state footprint for public use. We've donated airtime to run 1,000 COVID-19 PSA spots per week to our full footprint of 16 million video subscribers. For small businesses moving back to the workplace, Spectrum is providing a month of free services to any new customer that signs up for Spectrum Business as our connectivity provider. Additionally, Spectrum Reach, the advertising arm of our company, has partnered to provide free 30-second videos that any business can create and use on their website, social media, or use on television with a discounted TV advertising campaign. For our current customers, we're continuing not to terminate service or charge late fees for those facing difficult economic circumstances due to the coronavirus pandemic. Lastly, I want to highlight a very exciting announcement we made in May. Charter has invested $1 million in the Columbus-based Economic and Community Development Institute, better known as ECDI, to lend to small businesses across Ohio that sit in our 85-county footprint. This investment focuses on making loans to small businesses whose goods and services help meet the core needs of underserved communities. Being a national company, we're really excited to have that investment come to Columbus and serve our community. So moving on to today's program, shortly we will hear from a panel of medical and legal experts who will help us analyze the future of testing for Ohio and for our nation. We hope you will walk away from today's conversation with a better understanding of COVID-19 testing as employers such as yourself. Now I'd like to introduce Holly Gross, the Chamber's Vice President of Government Relations. Thank you.
Good morning, everyone. And sorry about that technical difficulties, but I would like to say a sincere thank you to Spectrum, who is the sponsor for the Columbus Chamber of Commerce Government Spotlight Series this morning. Spectrum is the presenting partner for today's program, and I know that they are excited to be a partner of ours, and we really do appreciate it. So today we'll hear from a panel of medical and legal experts who will help us analyze the testing for Ohio and for our nation. We hope you'll walk away from today's conversation with a better understanding of COVID-19 testing as an employer. So we understand that this has been a challenging time for many of our members because of the coronavirus, and a challenging time in America due to the state of race relations. We've been busy here at the Chamber working on your behalf, advocating on your behalf, and representing the business community at large in all levels of government. We recently submitted testimony in support of Columbus City Council's resolution to declare racism a public health crisis within the city of Columbus and Franklin County. And included in that testimony are some action items that we're working through as part of our Columbus Chamber Foundation. The Chamber has been selected as a technical assistance provider under the newly created Columbus, Franklin County COVID-19 Small Business Response and Recovery Fund. This fund will offer grants, low-interest loans, technical assistance for businesses impacted by the pandemic. So contact your MRS, and additional details will soon be posted on our website. You can also find information on the City of Columbus website. The applications are open now. We are working with local health department officials to answer the most common business questions related to reopening, and feel free to put those in the chat box today, and we're happy to submit those and release them as part of our guidance to our members. We encourage all of you that are open to customers and employees to follow all safety precautions and requirements, and contact us if you have questions regarding compliance.
Morning.
Yes, hello. Okay, sorry. So let's start the conversation today. So joining us are Dr. Andy Thomas of OSU Wexner Medical Center, Dr. Frederick Bertley of COSI, Congressman Troy Balderson, and Catherine Strauss of ICE Miller. Following this morning's discussion, we'll have a 10 to 15 minutes of audience Q&A, which you can submit again via the chat feature. So let's move forward with today's conversation. Good morning, everyone.
Good morning.
Morning. Good morning.
So why don't we start by each of you introducing yourself and the area of the expertise that you have as it relates to today's conversation about testing. So why don't we start with Congressman Balderson?
Good morning, and thank you very much, Holly, and thank you for including me in this important conversation today. And it's an honor for me to sit with this panel and discuss and talk about what we're dealing with and how we're going about moving forward with what we're dealing with. My name is Congressman Troy Balderson. I prefer to go by Troy. I have had the opportunity, and I feel very fortunate to sit on 3 very vital committees during this process. I sit on the Small Business Committee, which has been the writer of the PPP and the EIDL program, moving forward successfully with that program and to continue to update it as we move along. It's been, it's a very busy committee, but it's the busiest it's probably ever been. And several members of the committee have even talked about that. And it's a great committee. And I'm very fortunate to serve on 3 committees, and I'll go through that list, but I'm probably on 3 of the best, most bipartisan committees in Congress. And small business is also one of those. The other one is transportation infrastructure. We are actually having a transportation infrastructure markup as we speak. I mentioned to Holly earlier that I'll have to pull out a little bit earlier to go speak in committee, but their oversight is with FEMA, so that is greatly affected by what we're dealing with. And then I also sit on space science and technology, which is working with a lot of the research and development as we move forward. Myself and my staff, we've been working relentlessly around the clock, dealing with this and working through the issues and trying to help folks to the best of our ability. And we feel very positive as things move forward, and we want to continue being there for them. And I do want to stress to everyone on the call today or the conference, please do not hesitate to go to our website, balderson.house.gov. It is updated daily. We have tabs for even, small business, the PPP, all those things going through. So thank you again, Holly.
Yes, thank you. Dr. Bertley.
Hello. So I'm Frederick Bertley, President and CEO of COSI, your Center of Science and Industry here in Central Ohio. And I do want to tell you that this year in February 2020, USA Today announced that COSI was voted the #1 science museum in the country against all the other top science centers. And, can't make this up, 4 weeks later, we are now the #1 science center in the country that's closed. And so, of course, impacted by everybody. But I'm in this really interesting place in my life and career. I had the pleasure of being at the helm of a cultural institution which is one of the many important iconic institutions for the city of Columbus in Central Ohio. And so we're all about people and, enlightening people through experiences. And I love that. I'm also a basic scientist. My training is, strangely enough, you can't make this up, I'm a viral immunopathogenist expert who specializes specifically in retroviral infections. And I worked for years at Harvard Medical School McGill doing research in HIV vaccine development, which of course is a retrovirus. So while I'm not a basic scientist, or I don't practice basic science right now at the bench, I have this weird hat of having that expertise now at a museum that is closed because of this. And then you layer on the other 8,000-pound gorilla in the room, this very important but civil rights kind of racism that we're going through. And as a person of color and an African-American who also is a scientist who has always been in that quasi space where I just don't fit in, this is really, really a unique time. And so I appreciate, Holly, you, the chamber, all the distinguished panelists for having this important conversation. The last thing I'll say is all I'm looking out my window for is seeing two of every kind and an old man with a beard and a staff, because that's the only thing that hasn't happened yet. We haven't had the Noah flood. It's interesting to be sure, but together, and I'm being a transplant here, together I know the Columbus way and the Central Ohio way will help us get through this. So thank you.
Absolutely, thank you. Dr. Andrew Thomas.
Thank you for having me this morning. It's Andy Thomas. Please call me Andy.
Yeah.
I'm the Chief Clinical Officer at the Ohio State University Wexner Medical Center. I've been at Ohio State now for 29 years as of this coming summer. I've had the pleasure to serve as the co-chair of the command center for the Wexner Medical Center. We started work back in January on preparation for the coronavirus. We look at it as a large employer. We look at it as a large healthcare entity, but we also look at it as a community with a number of students that live on campus. Obviously, folks that work on campus. We're essentially no different than a small town or a medium-sized town. We have people that live there, so we have to think about it as almost a landlord as much as anything. So I'm also Secretary Treasurer for the Ohio State Medical Association, so do a fair bit with public policy from that perspective. And then I've also had the opportunity to help out with the governor's office and the Ohio Department of Health. I've been the zone leader for what's called Zone 2, which is essentially everything from Bell Fountain and Upper Sandusky down through Central Ohio, all the contiguous counties of Franklin County, and then essentially everything that goes out 70 east, everything that goes 33 south and 23 south. So it's about a third of the state. 43 hospitals that I've been trying to help coordinate as an air traffic controller, moving patients around and making sure that people have the resources that they need.
Awesome, thank you. And Kathy.
Good morning, everyone. Thank you for having me. I think the unique thing that I bring to the table is I know how to read rules and follow them. So I'm the lawyer of the group at Ice Miller. I'm a labor and employment specialist, and we have been knee deep, so to speak, in garnering and keeping up to speed with really ever changing and quickly changing law and guidance as it relates to employers' obligations vis-a-vis their employees and how to keep their employees safe, how to handle their employees during these times of crises, all of which we're going through that Dr. Berkey highlighted for us. But I'm here to help interpret and read and tell you what the rules are. I'm the rules follower of the group. Thank you for having me.
Thank you. So, Frederick, given your very unique and apropos educational background in immunology, can you help set the stage for our audience by giving some foundational information about COVID-19 as a disease, and anything else that you think will help really set up this conversation? Oh, you're on mute.
This conversation again is about testing, and especially in the workplace, but to level set, I mean, and we've all heard it, we've been saturated by the media with this pandemic situation. Just a few fundamental things that relate to why this testing issue is so important. So we have this bug called coronavirus, and it's causing this havoc around the world. The big issue is this is the first time we're seeing this specific bug. And so when you talk about the ever-changing landscape that you mentioned, Catherine, not only is that true in the legal world and drafting employment law as it relates to this, the ever-changing landscape of what we know as scientists and doctors, and I look forward again to hearing from the good Dr. Thomas, that it's changing daily, you know, the information we have. And so that's one. Two, because this virus is new, we don't even have a baseline understanding specifically of where it's spread throughout the community, its infections rates, who has it and who doesn't. We don't have a backdrop. Like if you think about a measles outbreak, for example, which happens every now and then, what we know in general, normally you have this level of infectivity with measles in any given cycle, and oh my gosh, because this is a new thing, we don't have those details yet, so testing becomes critical. And so once we can test whatever that critical mass is of people out there in community and society, we can have a much better baseline of how pervasive this virus is out there. And then we can make decisions accordingly in terms of, oh, maybe we don't need to wear a mask as much because it's a low level bit, or maybe we do, etc. So the topic specifically of testing, and then you layer on in the workplace where you're dealing with a population that's angry, frustrated, you know, been through it. I mean, people don't want to hear about this stuff. They don't want to have to wear masks. They're not sure how to operate within the context of employment. You know, we're redefining what the employment landscape looks like. You know, is it going to be at home 80% of the time, and you go to the office once in the blue moon? I mean, it's all this really bizarre racemic mixture of conflicting and conflating things that I was great. Back to the science, just the fundamental point I want to underscore here is this is a moving target. A lot of times people think science are facts. Science are not a collection of facts. Science is a process that allows us to ask questions to get as close to the truth as possible. And so the more we can exercise scientific processes through this, the better information we have and the more relaxed community can be.
Absolutely. Yeah, thank you for that. So I'm going to skip around a little bit because in case Congressman Balderson has to leave early. So Congressman, can you provide us with an update on any federal legislation that has already passed relating to testing and employer testing specifically, as well as contact tracing, and then any pending legislation that you would like to see advance on behalf of the business community, as well as any conversations that are being had now for any future policy proposals related to testing?
Yes, Holly, and to everyone, the last package that we passed, which was what we call the 3.5 supplement package, included $25 billion in testing, but it is also for research, development, manufacture, purchase. I mean, it includes everything in this whole environment that we're working with COVID. So that was important. Those conversations continue. You know, there is conversation about a next package. You know, amongst colleagues, we do speak and talk about that. But there's been no actual numbers that have been placed out there yet. The other thing that this also includes with this $25 billion that's I think is important that I want to speak about, and I referenced to the panelists this morning. It was interesting. I'm in DC, and I came out of my hotel room this morning out of my building, and right there on the street was an antibody testing facility. So people were lined up at 7 a.m. this morning to have antibody testing done. So that's the first experience I've seen with that. So I thought that was interesting. It was being done by the CDC. Big trailer. So, you know, it is happening. People were getting this done. So I thought that was very encouraging. As far as the tracing, the contract tracing, Holly, I think it's really important. And as we've seen in this COVID and what I've communicated with throughout the district and the communities, each population is different as far as the larger population. So I think, you know, that contract tracing piece, there are things that we can do in Congress, but I think the bulk of that has to come from the locals in making sure how we track that. When you go from a rural area to an urban or a suburban area, it's different. And a lot of people realize that, but I think it's important that the locals deal with that. And, you know, from the very first time that we were getting a hint of this coming, some of the first phone calls that I reached out to were my local health department leaders and commissioners. And I think that's important. And we continue to have those conversations moving forward.
I know the governor recently announced increased testing here in Ohio, and our Columbus Public Health announced just this week that they're doing testing, free testing over on Parsons Avenue. So we'll be sharing some of that information with our members as well. So Dr. Thomas, can you help us understand the current state of testing in Ohio from a medical and a research perspective, and given the rest of your experience in assisting the governor?
Certainly. So from a testing perspective, there are really two different types of tests to think about. And it's important to understand how you can or can't use each of these as an employer. It's something we at Ohio State are having a lot of discussions with other colleges and universities, certainly other employers in the region. So it is important to understand, and Catherine can talk in a second about some of the federal rules around the use of these tests. The first type of test is what's called a viral PCR test. It's a test that looks for the presence of the RNA of the virus on your body now. It isn't a perfect marker because some people can, like any test, can test as a false negative if they have very low levels of the virus. So maybe they just ran into someone with it yesterday and they're in what's called the incubation period. So that first 3, 5, 7 days where they aren't sick yet, but they're going to be sick. So there is a risk of a false negative with that. And then there are very few false positives for it. There are, the only way you really, we think, get a false positive is if you've had the virus. We have gone back and been retesting people. We think it can also test for dead virus, essentially. So the virus is there, but you're no longer actively infected. But there are very few other there's some cross-reactivity with other types of viruses, but it's very, very, very rare. Well under the 90% in terms of specificity. The downside of the test is it only gives you an answer for what you are today. So if you think about that incubation period of 3 to 5 to 7 days, if I have 1,000 employees and I test them all today and they're all negative and we have them go back to work, if they then say, well, I'm negative, I don't have to wash my hands, wear a mask, keep a distance from other people, be cognizant of the elevator buttons that I push and other things like that. You know, if they drop their guard because of that, you're at risk. And of course, you're, as an employer, and I'll stick to the employment scenario, you're not a closed system. Some of those people go home and go to Chipotle at the end of the day. Some go to their cousin Bob's house, and Bob hasn't been doing any of this stuff to protect himself, and he's actually an asymptomatic positive. So by 2 days from now, once I've gone over to my cousin Bob's house, then I'm actually could be sick 3 days later. So because our employment system is not a closed model where people live there, work there, don't interact with the rest of the community, it's probably not a great use for the average employer of your resources, of your staff's time, frankly, of our state's testing resources to test hundreds or thousands of employees broadly across an organization. Now, there are some where that might not be the case. So, for example, a child care facility where you're taking care of other people's kids. That's the one area at Ohio State where we have kind of mandated testing of our staff as we're looking to reopen our child care facilities. But frankly, if I'm not testing my ICU nurses who are actually taking care of COVID patients, as an employer, why would you test your law firm, your cultural institution? You know, you can imagine all the other employers on the phone. So, however, what we do think is really important is to have a plan. If someone does develop symptoms, that you rapidly have a way to get them into either their primary care doc's sphere or into some other sphere to get tested rapidly. Because what you realize is anybody who works within 6 feet of them or anybody who's had close contact with them, certainly their family, intimate partners, etc., those folks are now at risk and need to quarantine for 14 days. So you want to get that answer as quickly as you can. The turnaround time for those tests is typically within 24 hours. But if you're doing LabCorp, it could be 3 days or 4 days. But you want to pull that person out of your work environment really, really quickly once they develop symptoms. And then anyone who's a close contact should stay and work from home until they're tested back. So that's the basic story around virus testing. And then there's antibody testing, which is what Congressman was referencing. That's when your body makes proteins, usually 10 to 30 days after you have the infection. There's different types of them, so they come on at different times. But it's the body's way of fighting the virus. It's the same thing we look for in people who have been vaccinated against like hepatitis B. You can tell if the body's made antibodies to protect you against hepatitis B in the future. What that is a retrospective look. It's never right to use to diagnose acute infection, but you can look back and see, did someone have it? That test, Congressman, it's interesting you mentioned kind of curbside, street side testing for that. If it was being done by the CDC, that's, I'm sure, a very good test. But the one thing that did happen early in the process is the FDA allowed a lot of tests out on the market that had 20% to 30% error rates on the antibody testing. So you got to be really careful that you're not using some mail order antibody test that's not accurate. A lot of the local labs, LabCorp, others have really, really good tests for antibody testing that are in the 90+% accuracy range. But what that basically can tell you is you've had the disease. What unfortunately we don't know yet, to Fred's point earlier, this is a new virus for us. We don't know whether that means you're immune. We think it means you're immune. Typically, we think for any bug, we think that means you're immune, but we don't know yet for this virus. So a lot of people talk about a passport for return to work once you have this antibody test. I don't think the science is quite there. It's certainly better than having a negative antibody test, but we're not ready yet from a science perspective to say that you're completely safe. Now, Fred, is that a good, accurate description of that from your perspective? Good.
Absolutely. Absolutely on point.
So I'm not seeing Kathy. Are you with us, Kathy? I don't know if she was having technical difficulties. Okay, we'll move on and then come back to Kathy. So maybe can you dive a little deeper, Dr. Thomas, into what testing looks like moving forward? So, you know, I said Franklin County, the governor's office recently announced kind of some populations that will be tested specifically, and we're seeing more and more testing roll out.
Yeah.
When do you think that there may be some type of mandatory testing for employers or optional testing for employers? And what does that look like potentially in the workplace?
Sure.
I think also what, you know, is on the minds of many employers is what this might look like moving into the fall.
Right.
You know, you have a surge.
So in terms of mandatory testing, I don't think we'll ever get to that point, as I said, except maybe for some of those rare circumstances like a child care center. But I think if I knew that if I gave you an answer today that you're negative and that answer had more than a 3 to 5 day warranty, it might be worth doing this testing, right? But if I test it, I know we are paid $88 per test by the state. That's actually not even covering our costs, right, for the test. So if you have 1,000 employees and you want to test everybody, it's $100,000 basically by the time you count staff time, swab collection, et cetera. At $100,000 a time, and it's really only worth 3 days of comfort and safety, is that really a good use of your resources? Or would you be better off making sure you have a really aggressive screening system so no one comes to work if they're sick? Anyone who has a fever gets tested rapidly. You do rapid contact tracing throughout your company to see who might be at risk based on that's a better use of your $100,000 than a set of test results that frankly have a 3-day value to you. And like I said, then do people worry about they drop their guard because they know everybody's negative, everyone's been tested. Well, a week later, that's meaningless. So I don't think we'll ever get to mandatory testing. I think the way the state has designed the testing methodology, there are currently 5 priorities of testing. One is hospitalized patients that are sick and healthcare workers that care for folks that are symptomatic. 2 are people that live in congregate care facilities. So that would be nursing facilities, group homes. So any of those patients who get symptomatic, or if those patients or staff work in an environment where there's been an outbreak, they be tested asymptomatically.
Hey, Dr. Thomas, can we come back to number 3 in just one moment? Because I know that the congressman has to run to committee.
Oh, sure. Yeah, no problem.
For him the opportunity to give a remark. Thank you.
Oh, Holly, thank you. And Doctor, I apologize. I just thank you for having me. And I'm sorry that I have to take off, but I do want to mention, since The majority of the group is small business owners. We did introduce a piece of legislation today, on Tuesday, for a PPE tax credit. So that includes plexiglass, that includes all your PPE equipment that you've been paying for. So we're really excited about that. Did that with bipartisan support. So we look forward to getting that out. Please don't hesitate to contact our office. We can give you the details and the information on that piece of legislation at balderson.house.gov. And I'd love to talk more. Thank you to all the employers for doing what you're doing. Myself and my staff, we've been out and about already throughout the district and talking to business owners. And, people on the outside need to understand how seriously and responsible business people are being about this, whether they're restaurants, whether they're small business. I mean, they're doing what they're supposed to do and they're being responsible. And I know the doctor talks about, the testing piece of it, but the other really half of the important piece is protective stuff, making sure that we wash our hands and wear our mask and be cautious of what we're doing. And it was encouraging yesterday as I got on a flight to come over here, there were 79 people on that airplane jet. So, people are starting to get out and about, but the key is they're being responsible. And that is going to make all the difference in the world with this. So again, thank you so much, Holly and everybody. And I forgive everyone that I have to take off and go back to committee. I do want to make sure that Fred knew that we did a letter of support for COSIDE on a piece of legislation for a grant. So good luck with that. Thank you, everybody.
Thank you very much, Congressman.
Thanks for all you're doing.
Thank you.
Thank you.
Thank you for all you do.
Thanks. So back to you, Dr. Thomas. I think you were kind of giving the hierarchy of everything, and you were finishing up moving on to 3.
Priority 2 also includes people that are not sure they're safe to have that surgery. 4 are people that are symptomatic but are low risk, either by age or other illnesses. And then 5 is anybody else who's asymptomatic that's not otherwise listed above. And about 2 weeks ago, we were only testing priority 1 through 3. So for the first 2.5 months of this, there were people that were in their 20s and symptomatic who weren't getting tested if they didn't show up sick enough to need to be in the hospital. So we all knew that was a problem. That's what the governor's been talking about. We don't have enough testing. So our case numbers isn't what I follow in the state, because as you test more people, we started doing that testing 2.5 weeks ago. You're going to see your case numbers go up because you're testing more people. And we just moved to testing priority 5 last Thursday. So now we are to the point where any testing center, any hospital in the state, if you call up and say, I want to get tested, they should be able to test you. Now, they may put your sample at the end of the line, right? Because you're going to test those higher priority ones first. If I give you a 3-day turnaround on an asymptomatic person, it shouldn't be 10 days, but it may be a longer turnaround time, but you should be able to get tested. So we know that we'll see once again a bump up in number of people tested and then some positives because of that. Hospitalizations and certainly mortalities are ones where you don't miss many of those cases, right? That whether those people are sick. So that's a trend line I think that you can look at. When you look at states like Louisiana, that frankly had their first case about the same time we did, we made the decision to first with the Arnold, second with shutting down K through 12, all sorts of other things in March. Louisiana didn't make those decisions at the same time we did. If you look at the mortalities per 100,000 people, theirs is 3 times as high as ours is. Theirs is 66 per 1,000. Ours is 22 per 1,000. You can imagine if we had 3 times as many mortalities in the state of Ohio as we did today, people would be not happy about that. So I think a lot of the things we did, even though we didn't have the testing we needed, we put some things in place that did bend the curve. But frankly, it wasn't so much anything the state did or the ODH did. It's what the congressman was saying is the citizens of Ohio and the employers in Ohio are the ones knocking the ball out of the park, right? They are doing the right thing the majority of the time. And when I go out to the store, I don't see everybody in a mask, but I'd love to have it be more. But I think that those who are taking it seriously and those who are even just staying at home and ordering things delivery, et cetera, are the ones that are keeping the rest of society safe.
So, Kathy, can you welcome back? And can
Thank you.
With an overview of the legal landscape as it relates to both testing and contact tracing? We have received a number of questions from employers, especially around liability concerns. So if you could kind of give us an overview of where we are and where we're going.
Sure thing. So mandatory testing is permitted nationally for employers. That's been issued by the EEOC. Just yesterday, the EEOC announced that mandatory antibody testing is not permitted. And these are two considerations that are governed under the ADA, how we test and treat medical information and whether we as employers can require medical testing. So mandatory testing of the active virus is permitted. Similar to what Dr. Thomas said, it is a very specific analysis as to whether you as an employer should institute mandatory testing. And in addition to the examples Dr. Thomas gave, one that I would suggest you should consider, depending on your industry, is if you have had your entire or majority workforce furloughed and you're bringing everyone back and you work in an industry or business such as a food manufacturing plant where people are working in close proximity. So that is a good example of where mandatory testing would make a lot of sense. And depending on the next several months, that could be an issue that happens again, where there are multiple employers who have a majority or entire workforce that are furloughed. When you're bringing them all back to work, consider mandatory testing. If the circumstances of the work environment prohibit such things as social distancing or inhibit some of those other controls that we can all do and take care of ourselves. So if, for example, an employer decides that they are going to elect mandatory testing, there are multiple things to consider. One, you want to, if it's mandatory, then there needs to be a punishment or a discipline if somebody refuses. And so it's, in my view, it would be a term of employment. And so there needs to be a thoughtful process as to how an employer is going to handle a refusal, and whether the refusal is based on some kind of medical condition, which requires an additional analysis on behalf of an employer. Also, you want to have waivers. You want to treat it like you would treat flu testing. If you are a unionized workforce, you have additional considerations that you should consult with me, someone else at Ice Miller, your counselor, whomever that is. If you do engage in mandatory testing, there are a lot of steps that you should proactively think about before you set the testing structure up. Additional things include how you should pay your employees if you're testing them. What other privacy concerns, how you're going to treat the results, how you're going to store the results. They're medical information. You cannot store them with your personnel file. They need to be stored separately as you would treat any other medical information you might receive for FMLA certification or other ADA issues. You also want to consider whether you're going to make exceptions for certain reasons that are not medically related. And then if you also have employees that are tested positive, what are your obligations? And like Dr. Thomas said, it's a snapshot in time. So the CDC, which the Ohio Department of Health, either of those websites provide comprehensive information about what you should do if you have an employee who tests positive, and how long that employee needs to remain out of the workforce, and how long and how you notify those who have been exposed to that employee. An exposure is consistent interaction within 6 feet. And so you would have to this point about contact tracing, the very first step for an employer is to do internal contact tracing when they are aware of an employee who has a positive test. So the employer has an obligation to determine who was around that employee. And so in part, what we have been advising employers is, to the extent you can create shifts, you can eliminate personal interaction at the workforce. That is still very much favorable because it helps your contact tracing if you get a positive result later. So for example, at my law firm, we have shifts. I'm on the A shift and I'm only permitted to go to my floor on Mondays or Tuesdays. So that instantly helps with the contact tracing that needs to take place in the first place. And from there, you can narrow down who the exposures are. And my recommendation from an HR employment perspective is to have basically a graph that says, here's what to do if we have a positive test. That person needs to stay out until they've had they're either symptom-free, meaning no fever, no symptoms for 72 hours, plus negative test results in addition. And then what do you do if you have people who have been exposed? And that will depend on your industry. So if you're in a critical infrastructure industry, which could be healthcare, which could be food, then you might not need to remove your exposed workers from the workforce. But if you're not in a critical infrastructure industry, you may. So the key is really to be proactive in thinking about this now. What are the steps you're going to take? And who do you need to talk to, if anybody, to be sure that you're complying with primarily the CDC and the Ohio Department of Health, which is deferring to the CDC guidelines on all of these testing issues.
Thank you. That was incredibly helpful. This is for any of you, how long after an individual has the virus, after how long will they be able to see a negative test? If that's what an employer is perhaps looking for before they allow them back into the workplace.
Yeah, there are really two different answers to the question, and CDC's laid out two different approaches to return to work. One is a process related to just a matter of time, in terms of from the day you are symptomatic or the day you're tested, if you're asymptomatic, at a minimum a 7-day window after that, and then or 3 days after you stop becoming symptomatic. So that's one way to approach it. So if you're symptomatic for 6 days, that means you can't go back to work till after day 9. The other approach is a test-based approach. And I can tell you, I've had a patient that was positive for 3 weeks. We kept retesting him once a week, and he remained positive. To my point at the beginning, I don't know if I'm testing dead virus or if I'm not. He was completely asymptomatic for at least a week and a half of that 3. It was almost 4 weeks, actually. It was completely asymptomatic for a week and a half to 2 weeks, but I couldn't tell him for sure that he was cleared, could go back around his siblings, back around his parents, etc. He was a student, so he wasn't working, but the testing route is not without its problems.
Yeah.
Well, if someone was symptomatic and has become asymptomatic, that 3 to 4 days after that, you're probably safe, especially because in every workplace now, everybody's got a mask, everybody's distancing. Even if you did have a small amount left, it should be safe. I don't know, Fred, does that make sense from your perspective?
No, I mean, absolutely. And it just underscores the point that again, this being a new bug introduced in humans recently, we're the medical and scientific community figuring that out every day. Like, imagine you have a patient who's, testing positive all the time but completely asymptomatic or the opposite. So each bit of data we get to make better kind of medical decisions, which then impact, of course, the legal and labor decisions. So, and that's the biggest message I have, is that while this is tough on everyone, it does require a level of patience with your employers, with the physicians, with the nurses, with the scientific community, because we just don't know. 5 years from now, we could paint a perfectly tight canvas as to how to deal with this. We're not there yet.
So, Frederick, I'll stay with you. COSI plays such an integral role in exposing children and really the entire community and state and even the country to the fun aspects of STEM education. So how are you using some of your background and expertise on this topic to educate and inform students and the community at large about COVID-19 and infectious diseases generally?
Yeah, so, I mean, that's a great question. Very tough times, but every now and then there's some neat silver linings that come out. One silver lining that's coming out from this is more than ever, people are understanding the importance of science and why studying it and having literacy at some level. Not everybody's going to be Dr. Thomas, not everybody's going to be a PhD in immunology, but just having some vocabulary and understanding is critical. So that's one good thing. And because of that, they can't break into Dr. Thomas's lab, or you can't go to Battelle, but you can come to COSI or access COSI resources to learn more about science. And so we jumped on that right away. We launched a program called COSI Connects, which is a free digital resource, especially when the school is closed. So everything for the K through 12 space, for parents, for teachers, to just anything you want to learn about science in general to keep you active. And a subset of that, of course, is infectious diseases and coronavirus. But it's one of those weird things where, people are starting to understand, wait a minute, I'm not supposed to be an expert, but let me raise my IQ a little bit around this stuff. And we're leveraging everything from our digital resources, our great science and education team. But it's going to take a community. And my hope is when this gets under control, whenever that happens, that people don't forget about it and decide that science and medicine is in this little weird square over here, but it should be more pervasive throughout society.
Yeah, absolutely. We agree, and thank you for educating us in the community the way you are. So I had this question for Congressman Boulderson, but I'm going to put it to you guys as well. So to what extent do you think that testing and the availability of testing should drive our future policy making and regulations related to reentry back into the workplace and the reopening of businesses, or a potential thing or activity if we see a surge in the fall?
Sure. I'd like to jump in first and level set and in here. To do that, I'm going to try to get fancy and share my screen. Let's see if we can pull this off.
Advanced advanced meeting work here, Fred.
Trying my best. Let me see if it works. Hold on. You guys see PowerPoint?
Yes.
All right, perfect. So I'm just going to go to one slide and then I'll shut up. Real brief. Here we go. This slide right here. So can everybody see this slide?
So our
Yes.
kind of covering up maybe. Oh yeah, there we go.
All right. So in 2003, SARS hit, 774 people died in the world. Then in 2013, with H1N1, almost 20,000 people died. Right now, coronavirus is around 118,000, a little more than that today, are dead in the US, almost 500,000 worldwide, right? These are staggering numbers. But if you think about the flu, in any given year, and jump in here, Dr. Thomas, in any given year, we have 10,000 to about 50,000 people in the US who die from the flu, right? And guess what? Those are big numbers, but we accept that. We have a flu vaccine. Some people take it, some people don't take it, but we have a lot of morbidity and mortality associated with the flu, yet we've level set to accept that. And I'm saying that because your question, which was fantastic, and I hope I stopped sharing, your question, which was fantastic, is right now it's kind of crazy, but at some point when the vaccine comes out, and we'll have a vaccine and that'll significantly control how this virus is spreading throughout the community, we might have a residual of, 2,000, 5,000, 10,000, 30,000 people dying from coronavirus every year. And that might just be okay, just like we have it for the flu right now, without having mandatory testing for the flu. Some places you need, like for kids, you need mandatory flu shots, but there's no mandatory testing for the flu. We just take it for granted that that's okay. So I think we'll get to that point at some point, but I'd love to hear from the lawyer on that perspective, if you think that's true.
Yeah, I certainly hope so. It seems like from a legal perspective, getting back to this testing issue is a snapshot in time. It seems like a difficult burden to carry out in perpetuity. However, the real challenge are the populations that work in close proximity and those who are members of vulnerable communities. And it seems like there are a lot of practical solutions, such as a greater embrace by employers of teleworking to the extent possible, to spreading out the workday to the extent possible, meaning, for example, if telework's not available, but you could have individuals who might be susceptible or members of vulnerable communities start work earlier or work later. And so I think real practical considerations can drive the decision making and help the legal considerations.
Yeah, I think the major solution here is going to be a vaccine. And if that vaccine comes online, say January of 2022, 21. That's a terrific timeline compared to the way most vaccines are developed, take years, if not decades, to really fine tune. So if we can get a vaccine that quickly, it's a game changer. Now, you can imagine we've had discussions with Northern Italy, and even in New York, there was a little discussion of we don't have enough ventilators, and does Mary get a ventilator or Joe get the ventilator? There's only one left. And that's one sort of what we call allocation of scarce medical resources. But you can imagine they are not going to make 6 billion doses of the vaccine all at one time. We are not even in the US going to make 300 million doses of the vaccine all at one time. At some point, they're going to release it, and we're going to have to figure out as a society who gets the vaccine. Because even the flu vaccine, as has been referenced, doesn't keep you from getting the flu. It keeps you from dying from the flu. You just get a less severe case. There's some people it probably prevents it altogether, but mainly you get a less severe case. And I think it's going to come down to a real prioritization, whether it's by state, by county. I don't know how exactly the feds are planning to do this, where we are going to have to determine you get the vaccine, you don't, based on either what you do, your risk factors, if you had a kidney transplant, all sorts of things that can factor into that. But I think that's going to be the ticket to allow people to get back to some sense of normalcy. That being said, if not everyone in your community's had the vaccine, just because you've had it doesn't mean you can't still get it. You just maybe get less sick. You're still going to need to do testing of symptomatic people, right? Because I still need to know whether I could give it to Fred, and because maybe he didn't get the vaccine, right? So there's still going to be complexities that a vaccine will add to this discussion, but it will, in general, if you look on average for a society, make things safer.
I saw a study recently that was quite controversial by an NYU professor, or an NYU economist, I believe, and he talked about what the amount that it would cost to do daily testing with rapid results for the entire population. Do you know what I'm talking about, either of you two?
No, it would be a big number.
Yeah.
The technology would have to substantially change to make that viable. But even if you think about the rapid test that is called the Abbott box that people are using, that's what the White House has been using for daily testing of their folks. To be honest, that test is not really applicable to asymptomatic people. So even though that's a technology, because of the sensitivity of it, it's really best only for symptomatic people. The false negative rates for asymptomatic patients are too high for us to use it for testing for asymptomatic patients. So to get to be something like a glucometer that you would have in your home and test yourself each day, the technology is probably, that's like 4 evolutions of technology away from where we are now. That I have a whole bunch of crazy scientists over in the Biomedical Research Tower that are running PCR tests that, it would have to evolve not just 1 or 2 generations, but really markedly to get to that point. The other thing I will say is, even if I had today the desire to do that, I have to find a way to swab everybody every day, deliver those swabs somewhere. One of the weird parts of this whole outbreak was the PPE issues in China from a supply chain. Also, a lot of our swabs and swab kits were made in Italy, and they were supply chain, just the little thing to get the test. Reagent has been a major issue. The governor's office has been on the phone with CEOs of multiple of the companies that make the reagent. We've had days over the past 3 months where we could have done more testing, but hospitals in the state ran out of the chemicals you need to do the test. And if we're running out of that when we're testing 1 out of every how many people a day, 1 out of every 10,000 a day, I don't know how we could. This isn't like pulling some olive oil off the shelf, right? This is some complex stuff that needs to be designed. I don't know how we could ever logistically get to the point where we're testing everybody today beyond the cost of it.
And to add to that, the reason why those numbers were staggering is that, as both our great attorney and Doc mentioned, you don't want to do a cross-section kind of testing. You need to test people regularly, especially if they're being reintroduced to workplace and then going elsewhere and coming back. And so, Dr. Thomas's reference of a glucometer, diabetic folks know they got to test their sugar level every day, right? The fact that it was great today might have nothing to do with how you are in a week from now or 2 weeks from now. And that's where the price of this realistic testing to really have that deep impact on the snow becomes cost prohibitive, because you can imagine trying to do this test on the same person all the time through these expensive tools, not just, Q-tips going in the nostril, but PCR costs and antibody costs, they're very costly. And so when you do that analysis, that number ratchets up really quickly. But as Dr. Thomas said, we're not even close to having that capacity at this point.
And part of the issue too, in terms of testing an entire workforce over and over again, if you're, once again, taking symptomatic people out of the mix, if you're looking at just asymptomatic people, if you have a positive rate of 1% or 2%, that's pretty low, right? When you think about the haystack and you're looking for that needle, I'm not sure that it really makes sense. At the same time, if one of those asymptomatic people is coming to work, either they may be what's called pre-symptomatic, so they are asymptomatic today but going to be symptomatic tomorrow or the next day, you're going to catch it then. Or someone, if they get someone else sick in the environment, that person will become symptomatic. And with contact tracing, you might go back and test some of their routine contacts in the office and find that asymptomatic positive that got person number 2 sick. It makes the haystack a lot smaller to do it that way. I really think that no employer can make their workplace hermetically sealed safe. You really need to be able to live with ambiguity, react when you know someone is sick, put in place all those interventions the congressman was just going through, PPE, it's stuff that Catherine was talking about, is separating shifts, separating workforce in a facility. Those are the things that are of value because they impact everybody every day.
And if I could just add on, something Dr. Thomas just said is really important and we have not talked about from an employment perspective, is the safety and the lack of fear of things that you can do as an employer to encourage your employees to come to work, to be there with their full selves. And there are a lot of stories of employees being afraid. And so to the point of Dr. Thomas saying, it's much more effective to have testing around those who might have been exposed. Not only is that a more efficient way to go about it right now, it also enables or assists this idea of helping your employees' mindset, which is something we've not yet talked about, but this fear is a real thing that employers are facing on a daily basis. I get at least a call a day right now about how to handle an employee who is fearful, doesn't want to work. And so the more that employers can be proactive and planful, the more that they can use those plans to reassure their workforce.
Well, we have 24,000 employees at the university. Obviously, many of them are off working from home now, but from any employer's perspective, much like any family or any group of friends, any one individual's perspective on the coronavirus is along a spectrum, right? I always say I have some docs that really could care less about wearing PPE. They think this is all crazy. Some docs that want to wear a Tyvek suit from the parking lot before they walk in the door, right? The truth is in the middle. But not everybody, all of your employees are not going to be one way or the other. So if you put in a lot of these interventions, PPE distancing, shift work, whatever, some of your employees are also going to need convinced that this is the right thing to do. Just like, as Catherine was saying, some of your employees are going to be so fearful, they aren't going to come back unless you do these things. So you just have to realize that not everybody is of the same mind when it comes to this. But if you can stick to the science, stick to the CDC and other recommendations, at least you have a leg to stand on when somebody yells at you in either direction, right? Somebody's going to say, if you don't give me an N95, I'm not coming back to work. Well, I have nurses caring for COVID patients that actually have the disease that don't wear an N95 unless they're doing certain procedures or interventions. So you also as an employer don't want to err on the side of, well, I'm just going to buy everyone an N95 and then it'll be safe, because that's going to be the wrong message as well.
And Kathy, I think you brought up a really good point, the mental health piece. We're looking at that here at the Chamber, and our next workforce development series is focused around the mental health of employees and what employers should be thinking about. So for our audience, please look out for that in the near future. We're working with Ohio State Wexner Center on that. So
that's great.
So we're already over time. So I'm going to wrap and say thank you so much to our panelists. We really, really appreciated your knowledge and your participation in today's Government Spotlight program. I hope our audience has a better understanding of the current landscape of testing and feel more knowledgeable about what lies ahead, especially here in Ohio in the weeks and months to come. So if you enjoyed today's conversation and would like to revisit it at a later date, be sure to keep an eye on your email. You'll receive a link in the next 24 hours. And on behalf of the Columbus Chamber of Commerce, would like to say thank you for supporting our Government Spotlight series and attending today's webinar. We look forward to providing relevant and insightful programming to you in the future, especially through this new virtual world. We're hosting a roundtable discussion with Congressman Steve Stivers on June 25th, if you'd like to contact your MRS to register to attend that. And continue to check the Chamber's website, columbus.org/events, for future opportunities to engage with us. Thank you guys so much, and I hope you enjoy the rest of your day.
Thanks.
You're very welcome.
Thank you. Have a good day.
You too.
Bye-bye.
Bye.